Good morning, everyone. I want to thank you so much for coming to our Food Policy for Breakfast seminar series. I want to welcome you to Hunter College, New York City Food Policy Center's online panel discussion. My name is Charles Platkin, and I'm the Executive Director of the Center and also a nutrition professor at Hunter College. We're very fortunate to have several experts join us today to discuss the impact of food insecurity on mental health. Our panelists include Dr. Michael Burke, Social Science Research Analyst at the USDA Food and Nutrition Service. Dr. Khary Dean-Assael, the Director of Clinical Innovation and Practice at NYU McSilver Institute for Poverty, Policy, and Research. Dr. Craig Gundersen, Distinguished Professor at the University of Illinois and the Managing Editor of the scientific journal Applied Economic Perspectives and Policy. And Khary Lazarre-White, the Executive Director and Co-Founder of Brotherhood, Sister Soul, and an attorney. I want to thank you all for joining us today. Before I have the panelists introduce themselves, I want to let you know again about a project the center is working on in order to help connect New Yorkers who are most in need to available food resources in their community during the COVID-19 emergency. The center developed 59 hyper-local neighborhood food resource guides, which are updated on a daily basis. It can be found at nycfoodpolicy.org/food. Also, if you have any questions for our panelists, which we'll try to take 2 or 3 at the end of this panel, so about 10:30, 10:35, please email info@nycfoodpolicy.org, and the center's deputy director, Alexina Kath, will be monitoring those questions, and we'll try to get to a few before the end of the panel, depending on the discussion. I'd like to start by having each one of our panelists introduce themselves. We could start with Mike.
Hi, and good morning. My name is Mike Burke. I work at the USDA Food and Nutrition Service, which is the agency that administers the nation's largest nutrition assistance programs. I work in the SNAP evaluation branch. So my day-to-day job is doing research and evaluation on SNAP, and I've been at FNS for about 5 years. Prior to that, I was at the Food Research and Action Center for about 2 years as a research analyst. My background is in public health, so I have a PhD from the University of South Carolina. And what brings me here today, I think, is my work on food insecurity and its relation to health and well-being, and in particular, mental illness and disorders.
Khary?
Hi, good morning, everyone. My name is Khary Dean-Assael. I'm a social worker. I have been for over 20 years. I'm currently working at the McSilver Institute for Poverty Policy and Research, which is NYU's Silver School Social Work's Poverty Institute. I am the director of the Clinical Education and Innovation Department there, and I lead all the clinical work there. I'm also the co-founder of Fairground Inc., a food justice organization, anti-hunger organization, women-run organization. And I was recently appointed to the Human Rights Commission in the city where I live in Beacon, New York. I'm from West Virginia. I have been a social worker for over 20 years and really care about 3 main things, which is really around family mental health, childhood adversity, preventing and intervening around childhood adversity, as well as food justice and access. So I'm really happy to be here. And Charles, I really appreciate all the work that your center does.
Oh, thank you very much. I appreciate that. And so does Alexina, who's behind the scenes, the deputy director.
Thank you.
So my name is Craig Gundersen, and I'm the ACES Distinguished Professor at the University of Illinois. And Charles, I really wanted to thank you for asking me to be a part of this session. This is an incredibly important topic, namely the connection between food insecurity and mental health, that really has not received near the attention it deserves. So I'm really, really happy that you're shining a spotlight on this important topic. So I wanted to thank you for setting this up. I also wanted to thank Alexina for all the work she's put into this. And I wanted to thank equally importantly the audience members, is that you all could have been doing a lot of other things today. So I really appreciate you attending this webinar. I do work on the causes and consequences of food insecurity and on the evaluation of food assistance programs, with an emphasis on SNAP, the Supplemental Nutrition Assistance Program, formerly known as the Food Stamp Program. Really looking forward to our conversation today.
Thank you. Khary?
Good morning. Thank you, Charles, for the invitation. It's great to be in this conversation with Craig and Michael and Cara. My name is Khary Lazarre-White. I'm the executive director and co-founder at the Brotherhood Sister Soul. We are a social justice nonprofit based in Harlem, New York, comprehensive youth development organization that really works in the intersection of these issues we're talking about today, which at their core speak to an issue of income inequality and mass inequality in our country. And so what our young people face every day is a reflection of that income inequality. And that's kind of how we come to this work. We are a justice organization. We work on economic justice, racial justice, criminal justice, and environmental justice. And all of that comes together to create a multifaceted, multi-level organization that serves young people, trains folks across the country on our model, and works on these intersectional issues of justice.
Thank you very much for that. And I really am so appreciative to have you all here. And I want to get started right away, but just to say that we did try to have this event before in March, which we had to cancel because of obvious reasons of COVID-19. And at that point, everybody was flying in, including Craig and Mike, from their respective areas, which was really generous, but this is a much easier travel time, and thank you. I want to start by, just for framing purposes, to do a quick definition of food insecurity. I'm going to summarize the USDA definition, and then I'll ask you if you would like to weigh in. We don't have to spend a lot of time on this, but I do think it's important. So this is the USDA definition that we grabbed and we've seen and used. Food insecurity is the limited or uncertain availability of nutritionally adequate and safe foods, or limited or uncertain ability to acquire acceptable foods in socially acceptable ways. Now, I know that sounds so clinical, but that's the definition that the USDA uses. Does anybody care to comment or add to that before we get started talking extensively about food insecurity and mental health?
So that's the standard definition, and one that's been used by USDA since 1996. And it's become really the leading indicator of well-being in the United States today. It's closely followed by everybody. Just to add one thing to this is that it's based upon a set of 18 questions about food hardships, whereby people either can't get enough food, have to skip meals, things like this. And if respondents respond for only to 3 or more, they're considered to be food insecure. So this is the metric that's really extensively used across the United States in both local surveys, national surveys, and everything. And I think a lot of us, when we talk about, well, everybody talks about food insecurity, that is exactly what they mean. So I'm glad that you're using that as a definition.
Yeah, and I would just also say the way I think about it simply is, these food insecure folks are experiencing disruptions in the quality and the quantity of the household food supply. So they're worried about having enough food. They're relying on low cost foods. They're beginning to cut back how much they eat, like reducing their meal size. And at the extreme end, they're starting to skip meals. They're starting to not eat for a whole day. And it's all tied to not having enough most of the time it's tied to not having enough money to get enough food. So these are people and households that are really struggling to get enough food, and the quality of food is suffering as well.
Khary, you had a comment?
Yeah, I just wanted to add really quickly. I have Kathy Goldman in my ear, whom I've spent a lot of time with, who helped to start the food bank in New York City. And she said to me when we first started working together, what is food insecurity? Why are you calling it that? It's hunger. Just call it hunger. And so I tend to think of food insecurity as chronic hunger. Thanks to Kathy Goldman. Mm-hmm.
And just to add to that, because there are a variety of being hungry doesn't necessarily mean they don't necessarily equate, right? We know that the USDA goes further to define, very low food. I think it's very low food insecurity and low food insecurity. And I think, and again, this is from memory from 2 days ago, but I know that it's very low, I believe, is, and Mike and Craig, maybe you can weigh in here. Very low is related to hunger.
So there's two food insecure households are either what's called low food secure or very low food secure. Very low food secure occurs if you respond affirmatively to 8 or more of those 18 questions, 6 or more for households without children. Coming back to what Kara said is, oftentimes people will call this hunger, Part of the reason why the USDA went away from the notion of using hunger in the definition is to prevent some confusion, because people experience hunger, and then for those of us lucky enough to have enough money for food, we're able to alleviate that hunger. It's those who are not able to alleviate that hunger, is that those are the ones that are suffering from very low food security or food insecurity. Actually, virtually everybody who is food insecure also has at least some elements of not having enough food. So, and these are all due to resource constraints. In other words, if somebody is, I don't know, fasting for religious reasons or doing one of these long day fasts or something, but they have the ability to afford food, they would not be considered food insecure. It's only, as Mike said, is if you don't have the money to do so.
Thanks. So let's start your food insecurity and mental health. So this question is really about vulnerable populations, and we'll talk a little bit about that. But research has shown that food insecurity in children is associated with poor health and developmental outcomes and high levels of symptoms of anxiety, depression, aggression, and hyperactive inattention. Do you think this is a result of not having enough food? This relates back to that food insecurity definition. Do you think it's a result, or are these symptoms of physiological response to experiencing hunger, or is it mental anguish, a combination? And it would be great if we could talk about issues relating to the field and issues relating to what the academic information is saying.
So the leading indicator of food insecurity, so if we think about food insecurity, as people think about it, is we may care, and I care, and all of us care in and of itself that people are going without enough food, okay? But one of the other reasons why there's a lot of concern about food insecurity is A, the whole set of negative health outcomes associated with this, and B is the fact that there's much higher healthcare costs associated with food insecurity. It really is a leading public health nutrition issue in our country today, is food insecurity. But I want to come back to something about, is food insecurity an independent predictor? Absolutely. Is that we see time and time again that it's not poverty that leads to these negative outcomes, it's food insecurity. So even after you control for income, even after you have to control for household structure, even after you control for whether somebody's a homeowner or a renter, it still leads to these negative health outcomes. This is why we need to move beyond talking about poverty, in part because 70% of poor people are food secure, and instead begin talking more and more about food insecurity, because it leads to so many negative health outcomes, some of which you've noted and some of which we'll be talking about the rest of the conversation today.
Thank you. Khary.
Yeah, I would push back on that. I think from our perspective here in New York, just some kind of context around what we face in the city. There's 9 million people in the city of New York. Nearly 3 million live in poverty, on the poverty line. I'm proud to serve on the board of the Community Service Society. It's the leading anti-poverty policy organization in the city. I think poverty is a form of violence, as we know, when you experience poverty on the day-to-day, while food insecurity may be a data point in and of itself. For our young people, they are never dealing with one issue. These are intersectional issues. So 10% of the New York City public school system is homeless. 110,000 children are homeless. So if you're homeless, you're food insecure, but you also don't have a house to go to every single day. You also are struggling with often a lack of healthcare in terms of day-to-day things, whether it's diabetes, whether it's asthma, whether it's issues that relate to obesity. You don't feel safe moving around your community in terms of issues of violence. You're underprepared in terms of your school. So yes, going to school each day, if you do not have a full belly, we know that that's a direct precursor to low academic achievement, but so is not having a home. So is not having a winter jacket, in the winter. And so when we think about these intersectional issues, I think what we are talking about is income inequality and poverty. Brotherhood Sister Soul has provided 350,000 meals since the advent of COVID. Every Wednesday after this conversation, we're providing more food to our community, 350,000 meals, since March. People get online for food 24 hours before. If you are online for food, yes, you are food insecure, but when we put out coats for the winter, people are desperate for those coats. People are standing online. That means they'll be getting sick because it's 30 degrees outside. So then what's their healthcare access as well? Their children are online with them because they have no one to supervise children at home. So the children are not attending school. So now there's more academic drop as well. So these are intersectional issues that then reach, we're talking about mental health today. Our young people are going through trauma because of all of that. An upper middle class or wealthy person is going through trauma now because COVID is such infectious, no pun intended, disease that gets into all aspects of our life. And so upper middle class and wealthy people wake up in the morning depressed because of the state of COVID and the state of our society. Well, they can access mental health support. They can go to a therapist. They can see a clinician. What happens to people who are living in economic poverty? They don't have those types of support in the same way. And so the mental health, the physical health, the lack of access to school, the lack of access to proper medical care, it's all, intersectional for our population. And when we support our young people, we don't just support in a siloed way. We realize that we have to support the whole child because all of these ramifications are interconnected.
I think, getting back to one of the original questions you had was about how children experience food insecurity and how that could be relating to some of the mental illnesses. So I'm gonna comment on both of those. So I think broadly, to Craig's point, when we're doing this statistically and we're thinking about this in a statistical point of view, even when, so there is a broader context, and a lot of folks who are food insecure are low income. Most are, or living in poverty, but many aren't. And so it's super important to consider the whole context, like Khary was saying. But I also think at the same time, it's really important to realize that there are a lot of features of being living in poverty and being low income that affect someone's well-being. And, when we do tend to sometimes take this siloed approach, like, okay, we'll fix food, we'll fix healthcare, we'll fix this, but there is something unique about not having enough food. And I think, to Craig's point, when we time and time again look qualitatively, quantitatively, there's something unique about not having enough food and how that directly is connected to a person's mental health, about the shame they feel, the guilt they feel, the stigma. And so I do think we have to look holistically, but I also think food insecurity is one of the most salient features. Of course, not having a house is salient too. You need to have it all. We need to fix a lot of problems. To the point about kids, I think, in the past, 10, 12, 15 years ago, we used to think that parents, there was this idea that children were protected from food insecurity, psychologically protected, that they didn't really understand necessarily what was going on in the household. This was, we know now that's completely not true. Some work we did in South Carolina, I would go into households, we would sit down with the mom and I would interview her about the household, what's going on in the household. She would talk about food insecurity and she would be like, well, I really try, my kid doesn't really know. We really try and protect them. I go and talk to the kid and the kid's like, I know what's going on. I'm eating less. I'm going to my friend's house and I'm eating food there. I'm giving food to my little brother or sister. And so we realize that kids are aware and they're taking responsibility for food insecurity in the household, for not having enough food. And of course, that's going to affect their mental health. Of course, they're going to feel those same things about shame, about guilt, about stigma, about feeling inadequate, embarrassed. And so I think when we think about the things that make adults feel that way about food insecurity and how it relates to depression and anxiety, I think it's very similar for kids because they're experiencing those same things in the household too.
So just to add to that, and there's some noise in my background here, I'm getting an oil delivery, sorry, of all times. But going to that point, to all the things you brought up, I guess the thing that I think about is you talk about the shame and embarrassment of a child, and knowing that there's food insecurity going on in the household. And that probably causes, and I'm guessing, anguish and mental health related issues. And then also as a result of hunger, there's also physiological issues that are coming up. So I guess there's this combination, and I think, okay, well, which causes which, and how does it all work physiologically? But I guess now that I'm talking out loud, does it really matter from a fixed standpoint? Like, meaning, does it really matter which comes first, or what's causing what, if the hunger is causing, anxiety and depression, or it's the stigma that's attached to it, or a combination thereof. I guess it doesn't really, I'm trying to think with the panelists, doesn't really help us to know that specifically from a fixed point of view.
Go on, Khary.
Sorry, yeah, I was going to say that I think there's a bi-directional relationship, absolutely, and that's been found in the research. But I think of food insecurity as a trauma, similar to what Khary is saying. In the study that we conducted, we looked at adverse childhood experiences of caregivers, and we looked at childhood adverse experiences of children, as well as food insecurity. And as food insecurity increased, the child ACEs increased. And as adults experiences of adversity increased, child experiences of adversity increased. So there's this real relationship around trauma. And when I talk about trauma, I think it's really important to ground us in that definition for a second, is really about experiencing something that's perceived as life-threatening, as scary. It changes our worldview. We think of it as 3 E's. So there's the event or events, there are the experiences of those, and there are the effects. And so I think it's important for our conversation to also think about food insecurity as a trauma, but to also look at who's most affected. Because when we look at who's most affected, women of color with children, we realize that it's a social justice issue, it's a racial justice issue.
If I could give just one, anecdote, I think that underlines, what was just said.
Yes.
I think, in our work, we are, as I mentioned at the beginning, this kind of comprehensive social justice nonprofit that serves young people. Whatever young people need, we will provide, from mental health support to legal representation to food support, and then all the things you would think of in terms of youth development, from arts to international study to sports, et cetera. So we have 2 children who are members of our organization, a 10-year-old boy, a 15-year-old girl, and they would come every single week for our food distribution in addition to all of their other services. During that time, because we have counselors on staff, we noticed, of course, that the children didn't have winter coats. So that's kind of item number 2. They're coming for food. They didn't have sufficient warmth in the winter. When we asked why, it came out that there was an infestation of rats in their house, and the rats had eaten the coats. As we talked further, we saw bite marks on the children. So these children were going to sleep at night and rats were biting them, right? This was the reality that they were facing. We contacted the mother to figure out what was going on. The mother had fled a domestic violence situation. So another trauma point. We paid for a person to go to the house to, deal with the infestation. He said it was the worst he'd ever seen in the city of New York. He plugs the holes, we pay for that. We utilize our resources to get representation and to use our government relations firm to elevate, I won't go into the details, but the type of public housing that they're in, which is essentially a voucher system, think of it like Section 8, to ensure transfer is elevated because they could not be transferred. So now we have provided food, we've provided counseling for the child, providing counseling for the mother, ensured an elevation of the transfer of this issue, helped to secure new housing for the family. And in addition to all of this, provided direct financial resources so that in addition to food, other needs in the house could be paid for. Those are 5 or 6 inflection points for one child. And what brought that child to us, in addition to our programming, was food insecurity. But then it goes to all these other collateral issues of trauma that these children are facing that produce a situation where children are in an unlivable situation, do not have the clothes they need, the food they need, the books they need, the transportation costs they need. And that's what I mean by all of these collateral issues. And so, yes, food is absolutely central to that family, but by providing sufficient food without the other resources, we would have been providing food in a household that they could not utilize because literally of the number of rats in the house eating their food on a daily basis. So it's just an example of what it is in a very real day-to-day way to be in abject poverty, economic poverty in this country, and to have government, city, state, et cetera, abdicating its responsibility for a livable situation for children to learn, develop, and grow. That is the reality that children are in this country. And while, those issues may not be faced by every child in that situation, those kind of intersectional, collateral, connected issues, I think, are omnipresent.
So Khary, before you go, I want to just summarize something that I, kind of as I'm the audience of this panel, because I don't see the real audience, is that what you're saying is that by just fixing food insecurity, it's very myopic. And again, I know you said a lot more than that, but I just want to, and Craig's point initially, which I think was kind of not pushed aside, but I want to clarify that. And Craig, correct me or jump in if I'm wrong, but that just because you're food insecure doesn't mean that you're in poverty. I know you said a lot more than that, but I just want to get these 2 points out there. They're both critical, right? Because I think that, and there was something just in the New York Times, I think, not that that's the arbiter of food insecurity and research, but there was just something, and it resonated with me that, many people are food insecure currently that are not on the poverty line, below the poverty line. And that's, I think, the point you might have been bringing out. And I think one more thing, and I'll let you jump in, Craig, and that we need to create policy around these issues. We need to be really conscious and aware of what, Khary said. And we also need to be hyper aware of what, Craig's point of what the research is showing. Okay, Craig, I'm sorry.
So, no, absolutely. I mean, what Khary points out is there's a lot of other challenges facing low-income people in America. I don't mean to say that food insecurity is the only issue. The thing I was trying to concentrate on there was 70% of poor households are food secure. In other words, the vast majority of poor households are food secure. And part of the reason for it is, and I hope we get a chance to talk a lot more about this today, is SNAP. SNAP is the most successful government program we have. It raises so many people out of food insecurity. And because of SNAP, this is why we have the vast majority of poor households are food secure. That's great news about this. It doesn't touch to any of the other things that Khary was talking about, or Kara was talking about, or Mike was talking about. It doesn't touch any of those other things. But in terms of food insecurity per se, SNAP does an amazing job at alleviating food insecurity. And I hope we also get a chance to talk later about how I think the program can be made even better by expanding eligibility and by expanding benefits. But coming back to this notion about that there's so many non-poor households, roughly 15% of non-poor households in the United States are food insecure. So in other words,
can you say that again, Craig? I'm sorry, 15%?
15% of non-poor households are food insecure. So I think that if we just look at poverty or something, there's this often assumption that all poor people are food insecure. That's false. There's also oftentimes among some people like, we don't have to worry about the near poor. That's not true either. There's lots of, near poor people across the country who are food insecure. I mean, thinking about New York City, roughly the proportion of children who are food insecure is about roughly 10 to 15% of children in the New York City area. So, I mean, it would be much, much worse if it wasn't for SNAP. So there's some good news about that. But again, we need to figure out ways to make SNAP even more successful at helping those most in need.
So I want to go back to, stick to mental. I know these are the core issues and they're really critical to discuss, but I really want to connect this all to mental health. And I think that what we were talking about is the trauma that's associated and the, that there are many issues, not just food insecurity, that's creating this trauma. And I wanted to ask Mike about, there was a study that you did in 2016, I know that's a long time ago, in COVID years, showed that the severity of household food insecurity is positively associated with mental disorders among both children and adolescents in the United States. So what did that study find? And then I kind of want to open up to the panel to talk about the impact of that food insecurity specifically. We know what Khary was talking about, but specifically what happens with kids, aside from the shame and the embarrassment and the stigma. We also know that with school lunch programs, at least in New York City data, you see it going like this in elementary school, students using free lunch and going, down to high school, it falls, precipitously, like off a cliff. So Mike, I'll turn it over to you, and then also talk about racial discrimination, which I know that you did a study on, you were the author.
Yeah. So the study in 2016, basically we took a big nationally representative data set and we had some really good measures of mental illness in kids, so children and adolescents. And then we had a really good measure of food security, the Household Food Security Survey module that's used for surveillance. And we basically, after we consider a lot of demographic factors, what we found was a strong dose response relationship. So as food insecurity got worse, the rate of mental disorders in both children and adolescents got worse too. And the interesting finding was that held true for mental disorders that were less severe, but also for mental disorders that were more severe. So that really impacting kids. And so, this is an issue in the field. This was an observational study, so we don't really know the causal pathways about why this is happening. But time and time again in the literature, there was just a big meta-analysis done, and it pretty conclusively shows across a lot of studies that there is a strong association between food insecurity and major depressive disorder, general anxiety disorder, sleep disorders. And so I think we as a field, we know that it's there. And if you ever sit down and talk to anyone who's food insecure or experienced food insecurity, it's not surprising that there's a strong association. I think where we need to go now is trying to think through a little bit more about what exactly is it about being food insecure that's leading to some of these diminished mental health. And I also want to say, we often think about mental health and we think about, depression or anxiety, and that is true. But there are a lot of folks who are experiencing food insecurity that, they might have changes in their mental health, but it's not leading necessarily to a diagnosable disorder. And that's really important to consider too. And I think for kids and adults.
Can you just expand on that too, Mike, please?
Yeah. So I mean,
take your researcher hat off and scientist hat. Just tell me what you think as Mike Burke, if you don't mind.
About
what these issues are.
Yeah. So, I mean, what I think is what's happening is, especially in kids, is that they're just very aware and sensitive to what's happening in their household. When we think about all the stressors a household faces, not having enough food is just one of those big stressors that affects kids. It's creating a lot of uncertainty. It's creating pressures on kids that they really shouldn't be experiencing. They're worried about getting food for their sister or brother, their siblings. They're worried about saving food. And that's just having a profound effect on feelings of shame, feelings of guilt, feelings of not having control. And that's resulting in increased rates of depressive symptomology. So kids just feeling bad, feeling anxiety. And it's a really big issue. And to Craig's point, I think we have a lot of federal nutrition assistance programs like SNAP that if those programs were not there, it would be, I view food insecurity as kind of, it's in some ways it goes unnoticed sometimes. And I think because of SNAP, because of the school lunch programs, because of WIC, we're kind of keeping it at bay in some ways. But it's really hard for families and especially for kids. And it shows up. It shows up in the data. It shows up if you talk to folks. It shows up in the huge lines that we're seeing at food pantries that in the past were considered emergency use, but now are becoming more and more chronic, people using them much more frequently.
So, and one of the things that we did some testimony on food insecurity, among youth, and one of the things that came out was the research around performance, behavior, attention, timeliness, attendance, student retention, rates of graduation related to food insecurity. Kids have family issues, jobs, relationships, all the things that, Khary was mentioning. There's a lot going on for young people to have to deal with, and they're really a vulnerable population. And probably food insecurity impacts most. I'll add this one last thing. I think that, it's a tough issue with poverty and food insecurity. and this is the tough issue. If you believe that poverty, fixing poverty is the only way to get around some of these issues, which it is, but that could take 30 years. And what do you do about the food insecure right now? Khary, can you, I'm not an expert in this, so
I don't think it's that you can't fix poverty so you don't act on these issues. What I am pushing and arguing, and I think many others in the sector push and argue this position, is that we have to tackle these issues in an intersectional way, that we should not look at them in a siloed way. That doesn't mean that there aren't people who work just on food or on domestic violence or on housing. I think people dedicated their careers and done phenomenal work in those spaces. I'm not questioning anyone's work in that way. What I'm saying is, if we want to deal with what people, human beings, are facing on a day-to-day, people have intersectional, interconnected issues. And so when we think about solutions, all too often when we think about children in poverty, the response to children living in economic poverty has been one touch point. And that's why it hasn't worked. That we have to think about the connection of housing and schools and food insecurity and mental health support, because it's all connected. And so when our young people, when our schools finally reopen, right, and kids are coming back in large numbers, low-income children will be going to schools still with insufficient technology, in many cases inadequate or unhealthy food, lack of mental health support that they will need to heal in the way that we all will need to heal, inadequate education. You go down the line, over suspension, criminalization, these are all intersectional. And that child is arriving at one school, but all the touch points are within that one school. And so yes, food is there, but so are 5 or 6 other issues. And I think the only way we see our way out of this is to look at this through 2 different lenses. One of intersectionality and the interconnectedness of these issues, and 2, as an issue of justice. And that's why I started out about economic justice. I mean, this country has the resources to respond to this. We know for the price of providing standard housing for all people that are homeless in this country is the same price to buy yet another aircraft carrier. This country buys an aircraft carrier instead of providing housing for people. We'd be far more advanced on this issue if everyone had a secure home and then we were providing secure food. And that's, I think, the lens that we have to look at this issue through.
Yeah, that makes a lot of sense to me. So focusing on this, on students of food insecure and the stressors that they take, that they have between social media, jobs, relationships, exams, etc. The impact of academic performance, behavior, and attention, timeliness, student retention. Is anybody on the panel, are they aware of? And these are shown from food insecurity. Do you think these are from the hunger, from the stress combination? Again, I'm not trying to solve this problem. I just want to know what's on your minds and what you think about kids and how these specific things about behavior, performance, attention, and all those things are impacted from a lack of food or food insecurity.
I think they're absolutely connected. I think that, back to what Mike was saying, if you want to know how a kid is doing, let's look at how their caregiver's doing, because there's such a strong relationship between those two, right? I think that we will not know the effects of what our kids are experiencing right now for years to come, unfortunately. But what I do know is that there are things we can do now, like let's raise the amount of money that people are paid per hour for their jobs. Can we raise that and then look at the impact that has on food insecurity? I think that'd be an amazing start. I think there's a lot we can do to boost families. The work that I'm doing in my community is similar to you, Khary, where you're helping to put food on the table, but you're also running into a lot of other things and needs because they're so connected. And so I completely agree with what you're saying, that we have to start thinking of this work in an intersectional way continually. And that's not to take away from the good work that has happened. And there's so much more work that we can do. Reparations, let's do reparations and study that. Let's think about how we can improve the day-to-day lives of our community members. You know, there's more than enough food produced in this country to feed every single person. So that makes us stop and say, well, then why does food insecurity exist? And we know why. We do. So we need to start doing something about that.
So
Have we seen studies? Sorry.
Oh, I just want to follow up on just a couple of things. I mean, the thing is that, I mean, this is why SNAP is such a great program, is that study after study after study has shown that it leads to reductions in food insecurity. It's really a great program. Others and myself have been arguing for an increase in the maximum benefit level, which would then allow for even more people to escape from food insecurity. We estimate that increasing SNAP benefit levels by $160 per month would lead to a 65% decline in food insecurity among SNAP recipients in our country. That's a huge decline. That's the first.
Craig, could you add in there, will you start to see reductions? I mean, I obviously this seems like it'll be the case, but I'm asking you as an expert, will you start to see reductions in absenteeism?
Yes.
Attention, and I mean, that's what I want to, get right to. So you want to talk about SNAP. There are studies that directly show that if you add SNAP, this is what happens to a family, add SNAP dollars, this is what happens to a family, student attention goes, is better, test scores go up. I mean, those are the kinds of things that I think help, right? Am I getting this right?
No, you're getting this exactly right. Is we know that if you reduce food insecurity, you see all these other better outcomes. So this is why myself and others are just really pushing for increases in SNAP. I mean, it's solving food insecurity is a relatively easy thing to do. You just expand SNAP. Now, by no means am I saying that this will solve all these other problems. I mean, increasing SNAP will do incredible good, and this is why I think it's so important to do this. But I mean, back to what Khary said is, you have the other issue of the fact is that people are suffering from, housing insecurity. Well, maybe expanding Section 8 housing is a way to go. That's outside my area of expertise, so I don't have the specific solution. But at least we know that we have these policy tools, and in particular SNAP, that can lead to reductions in food insecurity, which then leads to improvements in mental health, which then leads to declines in absenteeism, which then leads to reductions in stigma associated with food insecurity. I mean, these things are all really important. There's other things that can be done. For example, part of the problem with New York City is your food prices are so high, is that you have some of the highest food prices in the country. This is why I say it's so hard to be poor in New York City. Move to Houston or Dallas, where things are a lot cheaper. In other words, this is a major issue, as is the sky-high housing prices in New York City. So there are issues with respect to price that we can talk about. But I think that just in terms of this, I'm a simple man. I mean, I look at food insecurity. And in terms of food insecurity is that it's a solvable problem through expansion of SNAP. It's, and there's other things that can be done, but the most important thing.
What about universal free lunch and
great. Yeah, I think universal free lunch would also help. But in terms of SNAP, is its size dwarfs everything else. I mean, these other things are important, but SNAP is such a huge program that it's really so important. But I'm also in favor of universal school lunch. That'd be great. And school breakfast.
Right. And talking about, continuing about childhood poverty and socioeconomic inequalities, oftentimes they carry on into adulthood. So lower childhood socioeconomic status is associated with chronic disease, poor mental health. What about the issues related to food insecurity? And again, if you know anecdotes or research related to this, that would be great. But how does that impact? I don't know the answer to this. And if you're food insecure as a child, what the likelihood that you're going to be food insecure as an adult? Is this something that's passed on? I know that poverty is generational. I'll throw that out there.
Part of the problem with understanding that is that for the longest time, we didn't have good longitudinal data where you had questions posed about food insecurity at different times. I think Mike is aware of some of this recent work that was done using the panel study of income dynamics, where we have information about children who were food insecure in 1970 and 1999, and what happened to them in 2013 and 2015. And back to your point, is we see a lot of intergenerational food insecurity, just like we also see intergenerational poverty. So absolutely is that it seems to be a predictor of food insecurity later in life if you're food insecure when you're young.
And Mike, do you have any of that? Do you remember any of that information or?
I don't know the exact details of it but there was a set of studies that was funded by USDA actually to look
No,
at.
I thought maybe Mike knew.
Oh, I'm sorry, Mike.
Yes.
Yeah,
I
to be
don't remember
honest,
their names.
I don't have that off the top of my head. I mean, I
Yeah,
do
I
know
didn't
that
too.
was a general takeaway, is that we are seeing similar, transfer between generations of food insecurity. And, I think that's, like Craig said, we're now just getting some of those data, and we're going to have probably more robust evidence. But it's not surprising, like you said, because of, it's I think through, children are seeing their parents experiencing these things. It's like we were talking about, it's tying to academic achievement and the unique role that food insecurity might play with that. And so it's not surprising, but I do think, we as a field and need to think, quantify it and think through a little bit more about how that's happening. But I also want to say, from a life course perspective, I mean, a lot of folks who are food insecure, it starts in utero. Some pregnant women who are food insecure have some worse health outcomes, and then it starts from day one. So it's not surprising from a life course perspective when we're thinking about all the chronic strains that babies and then children and adolescents and young adults are experiencing. This is not something that should be surprising, and it should be very, very concerning. And I think, because of programs like SNAP, because of other social welfare programs, we're able to make a big difference, but it could be more, thinking through what would a more robust social safety net look like, higher SNAP benefits, better housing benefits, TANF, that, participation in TANF and the benefits have just been on decline. When we think through all of those and we really support families and we really support children, we would imagine that will make a big difference in allowing those kids to graduate high school, to not miss those days of school, and then be able to go to college. So, it's a kind of a cascade of effects that starts very, very young. And, there's some work showing, thinking about, moms, women, and we were talked a little bit about the bidirectional relationship. So women who experience depression when they were pregnant were more likely to experience food insecurity down the road. So that's kind of thinking through the causal way this could happen. And so then you're going to have a mom who's depressed, who's having to parent her child or his child, and that's going to be more difficult. So we really have to start thinking early, and we really have to think about ways and places we can intervene to make sure that kids are starting young adulthood in the best possible place that they can.
And just dovetailing off of about gender, research has shown that, I'm reading this, female specifically vulnerable subgroups such as pregnant women, mothers, women at risk of homelessness, refugees, and those who had been exposed to violence or substance abuse are more susceptible to depression from food insecurity than males. My question was, why? Is this because women have historically been associated with head of household food responsibilities, or is it something else? And certainly, Khary and Karen, your work, I'm wondering if you see this. And Khary, I know that you work with families to improve mental health. As you work at Food Justice and Equity, creating programs around these issues. Is that something that rings true anecdotally for you?
Sure. Yeah, I think, historically women have managed the food budget and managed food in the home. And in our programs, mostly women attend, but so do grandmothers and grandfathers and fathers. And I think in general, when we look at mental health, that women and girls experience depression and anxiety at a higher rate than boys and men. And so boys and men typically have externalizing behavior issues. And I think there's a lot of socialization as a reason for that. But yeah, we have a lot of mothers who are carrying the brunt of and making difficult decisions, right? So am I going to be able to pay rent this month, or mortgage this month, or am I going to put food on the table for my family? And so thinking about those difficult choices and the stress, the immense stress. I think this depression and anxiety and even externalizing behavior challenges is really rooted in stress, and toxic stress is what trauma is, and that's, I think, what we're really looking at here.
And I mean, I agree with that 100%. And, I also think to be in a place of depression or to feel trauma due to the kind of conditions that Khary is talking about is in a completely appropriate response. I mean, what does it feel like to be a parent and you can't feed your child? What does it feel like to not be able to put a roof over their head or clothes on their back? A completely appropriate response is to be traumatized by that and to deal with, quote, mental health issues. The issue is, why are they in that position to begin with? I mean, we just went through a presidential election, and in addition to the, crazy carnival barker stuff that comes from Trump, just on the Democratic side, like, where was the conversation about poverty in America? Where was the conversation about a livable wage? All the things people are talking about, housing for all. These are issues we could tackle, and the body politic chooses not to tackle them. If people were not living in abject poverty so widely and dealing with the kind of food insecurity and housing insecurity and educational insecurity, then we would not have to heal so many people from trauma. So it's also about, where is a society going to invest its resources? But I think to focus also on the mental health crisis is to focus on, the symptom, and not to actually focus on the sickness that's producing that. And of course, again, we have to do that. But I also think we have to have the other conversation about, why are people in a condition that is producing mental trauma? Why are we accepting as a society, not us on this panel, everybody's doing work on these issues, but as a society, why are we accepting the starting point of, you will live a life in a space of trauma, and now let's cure the symptoms?
I mean, to that point, I don't even understand how food is, like, Craig's talking about SNAP, like, to me, and it's not just because I'm in this space, it's beyond my wildest understanding of how this is one of the most important issues, from a presidential, governor, city issue. I just don't get it. And I feel like I'm missing something, but I don't want to side. That could be a whole panel discussion, and maybe you'll come back for that. One thing that I can't believe I forgot this, because it's so important to me in the questions, but we just got a question from, thanks Kim for this question, because I think it's great. I won't reveal who it was, because she didn't say that I could, but it's a great question, which is about the quality, the nutrition quality of food and its impact. When and Alexina and I, we have these discussions, or, on the phone 5-6 hours a day. And one of the things that, comes up as a side, like part of our entertainment, I guess, is discussing how horrific it is that people think that, the poor and the food insecure should just eat anything. And it just enrages me, and her as well. And it doesn't seem, and I'm asked this a lot by media, especially during COVID-19 with high rates of food insecurity on the rise, ask, hey, what about the airlines are taking their excess food, feeding people with it? And I say, well, this is a tough issue, because are we checking a box saying we fed people, or are we doing some emergency feeding here and we're going to get to the quality later? And, typically my instinct, and I don't know anything about whether it's true or not, my instinct is that we're checking a box and saying people are fed. So my question, long-winded as it was, is, has anybody looked or thought about, on the panel here, about quality and the impact of food insecurity and mental health?
So I mean, this is, I mean, what we see, I mean, part of the reason why low-income households can't afford more quality is they don't have the resources. And this really is the critical strength of SNAP. I mean, SNAP enables people to purchase healthier foods than they otherwise would be able to, because it gives them more money. This is why others and myself are really pushing for higher SNAP benefit levels, such that people can purchase more of these. Oftentimes, not always, but oftentimes healthy foods does cost more. So in other words, to make it clear that people can purchase more of this. The other advantage of SNAP is that it gives dignity and autonomy to recipients, insofar as they can go shopping alongside their neighbors. They can go shopping in the exact same way, make the exact same choices, consistent with their cultural and other preferences within their family. So it gives dignity and autonomy to people, which I really like about SNAP, as it really does this. Now, back to this thing about emergency food assistance programs. I mean, I work closely with Feeding America and their network of food banks. They're doing these food banks in New York and everywhere else, doing incredible work in really stressful time periods. But they will be the first to tell you is let's expand SNAP. Because A, that allows them to concentrate on other issues within their food banking network and a lot of other things. So yes, is by getting healthier foods, and food banks are trying more and more to provide healthy foods, but also SNAP, again, makes it clear that people can purchase healthier foods because they have more resources. The other thing about that also is back to this price issue. I mean, New York is crazy with their high food prices. That also puts it out of reach for a lot of people. But by expanding SNAP, at least some of that will be alleviated.
Yeah, maybe give New York City residents more money, maybe, just a thought. But specifically, what about that quality? We know, I mean, we're, this I do know, and I am an expert on, food does impact mood, behavior, and quality food does that. So I believe, I guess, I agree with the autonomy, but what about those that are, in food, going to food pantries, and, SNAP is such a hot button issue. I just wonder if the administration, the current, the future administration is going to be able to really make that impact, depending on what happens in Georgia. And I'm no political expert here, but if I feel like the Republicans are going to block any increases in SNAP, but maybe I'm wrong, and hopefully I'm wrong. But what about specifically research or anecdotal stories about good quality food and how it impacts mental health? I mean, we know it does in the science, but I don't know if I've seen anything specifically about food insecurity, mental health, and and the science.
Well, what I would say is when we look at dietary differences between food insecure and food secure households, they're not as drastic as you might imagine. So I do think, so there are some differences. Food insecure households are a little more likely to eat some higher fat, higher sugar foods. However, food secure households and food insecure households are both doing poorly in that area. There's just a little bit of a difference. In kids, we see similar. The dietary differences aren't as drastic as sometimes people make them out to be. Food insecure children are a little less likely to eat fruits. But overall, the diet, and we see very similar between SNAP participants and income eligible non-SNAP participants. There are differences. For example, when we look at like the healthy eating index, which is an overall indicator of how someone's diet, it measures up to the dietary guidelines. There's a few points of difference, and it's not huge. And so I think when we're thinking about the link between food insecurity and mental health, it's sometimes easy to say, well, people are not making good, individuals are not making good decisions, and that could be the reason why diet differences are there that do show up. But I think, we have to realize that Americans in general are not eating very well. And we do need to focus on low income folks and try to get their diets improved. But it's always important to keep in mind that the differences are not that big. And so, we need to improve everyone's diet and not necessarily single out lower income folks in a negative way.
So let me just throw something in there. When there's two things. One is that when we look at, we just did a 3-center study with Columbia and CUNY and Hunter, looking at the impact of COVID-19 on food. And one of the things that we found in qualitative interviews in marginalized communities was that they're looking for more produce. So looking for healthier foods. So there's that. Then anecdotally, if you talk to food pantry operators, they're basically saying that the produce goes first. I just, so yeah, sorry, Mike.
Yeah, I want to be clear. Like, I want to be very clear that low-income folks have a much harder time getting fresh produce, fresh vegetables. It is much more difficult, and we need to support them in a lot of ways. Increasing SNAP would be one. Having healthier school meals is another. Supporting WIC. So there's ensuring that people have access in their communities. So that's absolutely important and critical. And so and we do know that low-income households have I have to be careful how exactly, because I don't know the research that well, so I won't comment. But what I will say is that there have been some discussions about incentivizing healthy purchases, and the Food Nutrition Service has done work on that, really rigorous randomized control trials looking at, hey, if you give people a little bit money back or incentivize their fruit and vegetable purchases, what happens? Well, it turns out they buy more fruits and vegetables. So I think that's one way we can leverage a huge program like SNAP or others. There's farmers market programs that do very similar things where
New
we
York City, Mike,
incentivize.
we have health bucks. We have
Exactly.
Health bucks in New York City.
Yeah, so incentivizing healthy purchases is a great way to reinforce, hey, you buy some vegetables, you get some more for free.
So we've tried to address some of these issues through our direct food work. So one is we run a youth-run farmers market that brings 30,000 pounds of food to 2,000 community residents a year in what's deemed a food desert. And again, nearly 35% of the vegetables and produce purchased are purchased through health bucks. So it's been absolutely critical to help get fresh vegetables and fruit into the hands of low-income folk. It's a youth run, it's in our community. We try to think about, what are the types of produce that people in the community would want. To Craig's point, I think there's not enough focus on cultural community desires with regards to food. So we really try to think about that. We distribute food every single Wednesday. In addition to the farmers market, we support a CSA, so that folks can buy in and contribute who have the resources to do that. And then, the third area is that we're doing this food distribution, and we have a partnership with Grow NYC. And so they're providing a box of fresh produce, but that box of fresh produce is insufficient to feed the family for the week. So then as an organization, we buy 7 or 8 large shelf stable items to add to that. Again, thinking about kind of a menu through the entire box of breakfast, lunch, and dinner, thinking about starches and proteins. We notice a couple of things. We notice there's a lack of protein in terms of what is distributed and what is available in the market, I think is one kind of shortcoming. I think the second, because of the price points, again, that Craig is talking about, but also seasonal issues in New York or the Northeast because of winter, et cetera, is what is the fresh produce? And so many of the folks who get food from us are not that interested in squash, as an example. Right? So that's something that culturally they're not usually used to cooking. So what are other kind of winter vegetables and winter produce that people would want? It doesn't mean people won't cook it and eat it, but folks should have some choice. And we keep coming back to this word of dignity. It shouldn't just be to use, your point, Charles, about, airline food that we don't want to eat when we're on the airline. I mean, it's disgusting when we sit on the plane. So why do we then want to take that food and give it to folks who are low income? How do we treat people? Are we providing food with dignity? One of the things we're proud about doing are partnerships with restaurants where they also give us a meal for the day, right? It's hectic to go out and shop right now because of COVID. Well, it's even more hectic to stand online for hours. And if we can give you a large quart of stew from a restaurant so that when you go home, you have something for a moment, just kind of treating people in a more humane and decent way, so that the moment you get home after waiting for hours on the line, you don't have to then start cooking your meal, but you have something, some sustenance for you and for your family. Just trying to think about inflection points that treat people with decency when they are confronted with an overwhelming reality. And, these tensions rise on food lines all across the country. We all see it. I just think if we can, again, cut underneath that and look at what does it feel like to not have sufficient food for your children and your family, that is a devastating moment to be in for a parent, for a mother, for a father, for a grandparent. And so how do we treat people in that moment really, really matters.
Yeah, and just as an aside, the podcast on the Daily of the New York Times did something on the day of the food pantry. I think it was on November 25th. I really suggest anybody listening, in the listening audience, take the time. I don't care how busy your day is, and listen to that. It's so impactful to hear. It's very powerful and moved me in such a way. And there's one particular thing that came, about a woman who was talking about how she's, I'm paraphrasing obviously, that she was happy that she could wear a face mask so that people in her community didn't see who she was waiting online for food. And that tells you a lot about the stress and the conditions of people that are, first timers, online for food and trying to make themselves whole and provide for their family and be able to eat. And thank you for those comments, Khary. And I guess one of the other questions I have, and I don't want to hijack this, but I would like to ask you, Craig, and Michael, and Mike, about metrics. And I know that you're both involved with these metrics, but when I look at discussions about food insecurity and mental health related issues, and and talk to Joel Burke, who's from Hunger Free America, and ask him and say, hey, how do we know more about what's going on in our community in terms of food insecurity that's not anecdotal, that's not relying on the U.S. government, that we can pay or get funding to try to do a New York City, monthly food index, food security index, and how would that help us? So I just wanted to quickly ask that. And by the way, if you're in the audience, we only have 6 or 7 minutes left, but if you do email your question in at info@nycfoodpolicy.org, we've gotten a couple in. We could still get one more in if you email in right now. Thanks. So sorry, I'll leave that to Mike and Craig.
The good news is we do have this local level estimates of food insecurity. So for those of you who are interested in the audience, Feed America has something called Map the Meal Gap, which provides estimates of food insecurity at the county level for all counties in the United States, for both the full population and for children. B, it has estimates of what's happened to COVID and what the resulting implications for food insecurity for this. And also, in addition to this, of course, county level estimates, if you look at, New York, as you get these county level estimates, but what you want are these sub-county level estimates. So the government of New York City has been putting out these sub-county estimates at the census tract level and at the zip code level, the extent of food insecurity in their communities. So it gives a really vibrant picture of what's happening to food insecurity at the sub-county level. Because as you know, in lots of parts of New York, some of the greatest wealth in our country is in certain areas, and literally 5 blocks away, you're gonna have really high rates of food insecurity. And this work that Feeding America is doing in conjunction with the food banks of New York, the 2 food banks in New York City, really shines a light on the massive disparities in food insecurity within our areas. Fantastic wealth aside, abject, really high rates of food insecurity. So in terms of metrics, we already have all that information about the extent of food insecurity at the sub-county level in New York City, at the census tract and zip code level. And the New York City government is using this extensively as our food banks are direct resources.
And Craig, how do we get that information? Is it phone calls?
If you send me I don't know. You can send me an email and I'll put you in contact with the relevant people in the New York City government and also at the 2 food.
No. How is the information that they're getting? What's the methodology of collecting the data?
Okay, I will just state it briefly in 2 sentences. We estimate the predictors of food insecurity at a higher level, because part of the reason is that there's no census tract level data about food insecurity. So we estimate these at a higher level, including the main determinants: unemployment rate, poverty rate, percent of households that are disabled, home ownership rates, the standard set of deductions. And then we use what's called the American Community Survey to get local level estimates of food insecurity in communities. Study after study after study has been done about the vibrancy of these estimates and how accurate they are. So if people in New York are interested in these, let me know, we can move forward.
Thank you. We have 5 minutes left, and I guess in the last 5 minutes, I'll ask each one of you to weigh in. I usually don't do this at the end of it, but just briefly, can you discuss a study or anecdotal story that your experience best represents the most important issues of how food insecurity impacts mental health? Is that just a sentence or two, not a story because we don't have enough time, or something that you could mention, sort of closing words in the last few minutes? Start with you, Craig, because your microphone's open.
So I would just emphasize that, that we don't talk nearly enough about mental health issues in the United States. Back to what Khary was saying, is that we really need to talk a lot more about the trauma associated with food insecurity and all these other issues associated with poverty. So I think by talking more and more about this, and again, I'm a simple man, all I talk about is food insecurity. We alleviate food insecurity in the United States. This will go a long way to addressing some of these mental health challenges.
And Khary?
I think less anecdote for me, more just, a couple of reference points. I think, we have seen this incredible increase, obviously, in this time due to the lack of supportive families during COVID. And these are current choices. So when we talk about this isn't just about the historic legacy of this country of economic exploitation of workers and low-income people. Just look over the last year in other countries all around the world that are providing a livable wage from the government to people so that they don't fall into poverty, so that they have food access. And this country has refused to do that. I mean, that's why we're seeing the lines. There are different decisions made all around, the nation. And when we talk about, New York City, just 2 data points to Craig at the front end and the back to speak to what he said. The greatest disparity of wealth of any county in America is the county of Manhattan, New York County, where the top 5% earn $860,000 a year, and the bottom 20% survives on under $10,000 a year. So all the choices that have to be made about the things that we're talking about are those front realities. That's at the forefront. What's the result of that? Last data point, in Manhattan, Central Harlem, lifetime expectancy rate is 70. 2 miles away, Upper East Side, lifetime expectancy rate is 91. People are losing 21 years of their life because of all of these interconnected issues. That's the end. And then the front is what people are living in on the day-to-day. It's why we have to do something about this in a much more comprehensive, interconnected way.
Khary? Sorry.
Thank you. So yeah, we know that food insecurity really impacts family processes, family functioning, how the relationships in families, the interactions, which to Mike's earlier point really does have a trajectory across the life course. And I think from my perspective as a social worker that we're asking about food insecurity experiences in our work with young people, with families, I think is imperative. I think that at the same time, there are policies and procedures that need to be evaluated. We do need to attend as a culture around poverty shaming, around that people call me with my nonprofit to tell me that they're in need of food, and I think how brave and how scary that must have been. And so to take away we have to think about how to attend to stigma and shame in our culture so that people are not living in fear and living with these traumatic experiences alone.
Thank you. And Mike?
Yeah, I guess I just want to emphasize the scale of the issues we're talking about. I mean, 20% of US adults have a mental illness. 13 to 15% of US households with children are food insecure. And so this is a massive problem. And we need to, and I think we are to a certain extent, we're all working towards solving these problems, but I think sometimes it's lost on a lot of people how common these issues are for so many, especially low-income folks in the United States. And so, I think strengthening our social safety net is really important, and strengthening SNAP. I think getting people connected to good paying jobs that pay good wages, making sure folks are graduating high school, getting that college degree, and also connecting them with their community, thinking through, the interconnectedness like we've been talking about, getting folks connected to food again in their community is really important. I mean, that can be done in a lot of ways. That can be done through food pantries, community gardens, ensuring that folks feel connected to their community and the places that they get food. And I think when we start lining up all those things and we're addressing food insecurity, we're addressing housing, we're really going to see drastic declines in poverty, and we're going to see drastic declines in food insecurity, which will all absolutely help with mental illness in the United States.
Thank you. And we're out of time, but I just want to thank Mike, Craig, and Khary and Kara for all the work that you do, which is so incredible and powerful. And it's so nice to hear your voices today. I thank you all in the audience for coming, and everybody with their incredibly busy and complicated schedules to take time out to listen to this important issue. And again, fascinating talk and discussion. Please make sure to check out nycfoodpolicy.org and make sure to sign up for our weekly news digest, where we have news articles, curate incredible research and everything that's been done for the week. Thank you so much for joining us, and have a wonderful holiday season. And remember the food insecure, remember the hungry. They're really important issues, and let's push for increased attention on these issues. And thank you so much again, and have a wonderful day. We'll talk again soon.